I'm a pediatrician and a health advocate, and I've been doing some work with consulting. And one of the things that we're trying to look at is how to diversify the patient and family advisory councils that many hospitals either have or are mandated to have. And I'm curious about the panel's thought regarding how to best do that. I think that there are some true barriers that limit the interest of Black and Brown communities, as well as their, realistic ability to participate. But then, there also is this element of tone deafness among many institutions that they even need to have representation on these advisory councils.
I have a really short answer to that. Make it worth their while. Pay them, give them something they need. Like, there's no reason to ask people to help make us better if we're not willing to provide some incentive for them to do it. That's my answer.
And I was going to say the exact same thing. So right on point, please. The only thing I was going to add is that you assign them a very clear set of authority. I think often people don't like anything that kind of sounds like, BS, like you're just going to hear my advice and it's not going to result in anything. So I would actually identify areas within your institution that you specifically are going to give onto their recommendation. That is and you're clear and upfront about that. And I think that goes into what Cec was saying, is about making it worth their while. It's not just being compensated, because I actually do know a lot of clients who have no interest in getting paid. They would love to just give you their opinion. It's often just it's inaccessible often. We want it to be in person, or if we do have it digital, we don't take into consideration the digital divide and their inaccessibility to certain tele resources. But then making it worth their while with both compensation and actually, prescribed authority that they have.
And what does that feedback loop look like? Like whenever we do these coffee chats or listening sessions or whatnot, at the end of every one, you have to write down, you have to summarize what was said. And then when you come back a month later, 3 months later, whatever the cycle looks like, you start the meeting of saying how you did or did not respond to each one of those issues. So people have agency and know that their thoughts are the number of cabs that I've been a part of are like, oh, we've always just talked into the wind. This is the first time anyone's ever really listened to us. And then that piece of making sure you're highlighting their efforts. If you have a newsletter, if you have anything, making sure there are pictures on there, making sure you're very clear on who said what and what contributions they gave, because people really want to know that this time that they're putting in is going somewhere. And the paying piece, if you know how much you're paying those consultants who come in to develop this program for you, if you're not paying your participants approximately the same per hour, then that just says where your organization, not your personal, I love you, Nicole, but where your organizational values are. So case in point, if you're writing a grant or a proposal and you're putting in, when the budget time comes up and you have to put in how much you're going to pay someone who's going to be a part of your program development and how much someone from academia is going to be a part of your program development, you'll see massive discrepancies. Oh, they're going to get a $25 gift card, but this person coming from academia is going to get $300. Come on.
Yep.
And I'll just jump in, Nicole. Go ahead.
No,
Go ahead.
I was sorry, Jim. I was just going to say, Dr. Blackstock, there was I wanted to respond to a follow-up comment that was in the chat box around NIH cabs don't precludes members to be paid. So I wanted to say that, I'm actually not familiar with NIH specific grants. And I think just broadly talking about advisory councils, I would say a couple things. One, I have grants that don't allow for the compensation of advisory councils, but it does not preclude advisory council members being compensated. You just can't use it for that funding. If in the event, which I suspect NIH doesn't want any form of conflict, period, so there's no compensation that could take place, I would say that to my earlier point around prescribed authority, a lot of times people just want to know that what I'm doing matters. And sometimes when people are paid, that has two effects. It has the effect that one, I'm getting paid. And then 2, it's this matters, right? But you can many times supplement people not being compensated if it's the right person who's not in a critical desperation of need, but it's an individual who can, certainly give a volunteer time, and they still are a patient, and they're available. Making sure that whatever advisory council capacity they're in, that it's one in which they feel as though I am responsible for this. And because I made this decision and made this investment, this then occurred. And so I think making those connections very clear for the community really helps people feel enthusiastic, especially when there is no compensation.
Right on. And I'll just say, I love everything that's been said. Transparency, take good ideas. If any good idea, and implement them. Don't be afraid of someone else's good ideas. They'll make you look good. They'll make the institution look good. There's nothing more annoying than being on a cab or a CAG when you are presented something that the ink is already dry and they just want your rubber stamp. The ink has to be wet, or it has barely begun, like the story starts and in the beginning and then the rest is open. That's when you need to bring people in, engage them from the beginning so they can birth something together, and take good ideas. Don't be afraid of them. I think a lot of us hold on and think, well, if someone else has this idea, I'm no longer relevant or I'm no longer good, so therefore we can't take it. That's the death knell. That's the death knell of getting people engaged. And finally, on the technology front, we've learned a lot during COVID. And a lot of us now are on Zoom. They have never been before. So access to these meetings, if people don't have the tools, give them the tools. That's not direct compensation, but give them the proper device so they can participate in a Zoom call with the team and schedule meetings that fit the lives of the people you're engaging. If you have a CAB meeting that does not really fit the work lives and the personal lives, the family needs of the people who you want to engage, then you're really doing them a disservice. They're just there to be a name on a list. They feel like a name on a list, and they really don't have any impact.